could not accommodate more people in our residential programs, and there is a huge demand for our biomechanics courses, and so I decided that we could do a little part of it remotely, and this could be a little introduction also to our residential program. This course is divided in 3 modules. Those who are here are registered for the first one, and we have in this module 2 sessions. One is today, 4 hours, and then we have 4 more hours in 4 weeks, I think. So the whole the 2 sessions together, they are dealing with topics that we deal normally in the first week of our residential program. In the residential program, we do other things as well. We do practical parts, but probably we are going to discuss in this module some very important topics of the first days of our course. So you see the title of my presentation here. Now I will leave, you won't see me anymore. You will see my PowerPoint screen. And so the question is, why should we know biomechanics so much in depth? I mean, the reason why I teach biomechanics is because I can meet a lot of nice people, and also because it's a lot of fun to teach and to go around the world, and sometimes to have a course here at home while other people are connecting from many other countries. But besides this joke, why should we learn biomechanics? Why the basic biomechanics that is taught everywhere is not enough? That's what I think. And the reason is that we are not in what I call an ideal orthodontic world. We're not treating only beautiful people. We're not treating only easy cases. We're not treating this kind of guys you see here in this picture, or at least we do sometimes, but that's not the rule. And it's very difficult to treat all patients just with recipes. So we need to do something more. I'll always get this very good results if you just use your standard and basic mechanics. Sometimes, or maybe even often, you can do, but there will be times that this will not be enough. In an ideal world, we don't need an orthodontist because we have only easy cases. We don't need specialists. I mean, more or less, these easy cases can be treated with Invisalign. And what I'm saying is that GPS are perfect for easy cases. You can treat most of these easy cases just with Invisalign. The real thing is that we have to do something to treat this kind of cases you see here. I see cases in my office that are referred by other orthodontists, they are referred by other dentists with a lot of complex things, period problems, TMD, difficult movement of the teeth. So if you have to do with these people, I think that biomechanics knowledge is really very important. So if you have a real life as an orthodontist, there are no easy recipes for them. And look at this guy. This is Siva. Siva, I hope now you don't see slide number 1 because there's your face in the slide. And why did I place this picture with him here? Because I have a lot of my friends, my students, my colleagues that time by time contact me to tell me, Giorgio, I have a case, I've been referred a case that I really have trouble to handle. So these very difficult cases are not so uncommon. You get so there are problems. If you have to treat difficult cases, and you might run into problems, and then you need biomechanics. But how much biomechanics in it? The little biomechanics that everyone learns in any program is not enough. The threshold of biomechanics knowledge I think you need in order to be able to apply the biomechanics concept to your real clinical life is quite high. So it's not possible that you just, okay, I will study biomechanics for 2 or 3 days and then I put this concept in my clinical practice. It's not possible. You need to work more. The threshold for clinical application of the biomechanics is rather high. But it's worthwhile to get it, because once you have a real good biomechanical control in what you do, you are really free. You are not constricted by what I call the standard appliances. You can really do something different. Now, I don't want to lose a lot of time for this introduction. And so we will start in a few minutes the lecture itself. And I would like to do this quiz that those who have already followed my course know this picture.
So now I would like to ask to all of you, what do you think about the possible movements of these teeth? And especially I'm thinking to the movement of the right canine, upper canine, and of the right lateral incisor. So what would you think? Now, if I ask to all of you about this prediction, and I've done this test a lot of times, probably most of you would think that we will get some intrusion of the lateral and some extrusion of the canine. And at the same time, we would say that the canine is going to the palatal side, while the lateral is going backward. But when we see the real result, here we see them. We see that something completely different happens. And this is not just what you think, it's just what the great majority, not to say everyone, is thinking about a case like this. So what is the real problem? Is that our usual capabilities of prediction of what is the outcome of a standard edgewise appliance using large deflection and superelastic wire is quite limited. So we have to improve this. We have to improve this. And one thing that we can do is to increase our capabilities to understand this kind of mechanics, but also the possibility to learn more biomechanics and to build up some kind of appliances that can be more predictable. So with this, I finish our introduction, and I would and I do hope that you will enjoy the whole course. This is just the real beginning.